The Appropriations Committee will come to order. This morning we're going to begin by listening to the budget from our Missouri Secretary of State, Mr. Denny Hoskins. So would you please start, Mr. Secretary?
Thank you, Mr. Chairman, members of the committee. For the record, Secretary of State Denny Hoskins from Warrensburg, Missouri. It's a pleasure to be here with you today. As Missouri's Chief Elections, Records, and Business Official, my responsibility is straightforward: to ensure the Secretary of State's office delivers essential services that are accurate, accessible, and worthy of the public's trust, while being careful stewards of taxpayer dollars. Over the past year, our office has focused on doing more with what we have by streamlining services, coordinating resources, and being intentional about outreach across every division of the agency. In business services alone, we've processed over 135,000 business filings over the past year, and in total, our office has served over 1.5 million Missourians and Missouri businesses all across service areas. These filings are not just paperwork. They represent entrepreneurs starting companies, families passing businesses down, and employers creating jobs in our communities. And when it was brought to our attention about an alleged Chinese-owned trailer park right next to Whiteman Air Force Base, we took decisive action and legally revoked their business license. In elections, we've continued to modernize and centralize voter-facing resources through tools like showmovotes.com, making it easier for Missourians to find accurate, nonpartisan election information in one trusted place. Behind the scenes, we've also enhanced voter roll maintenance resources by working with available federal partners to better support local election officials, always respecting Missouri's authority over elections and the vital role our county clerks play. And so it's been a focus of my administration to really work on cleaning up the voter rolls. And so we've been working with Republican as well as Democrat local election authorities. And over the past year, we've taken off over 200,000 ineligible voters off the voter rolls, including 60,000 deceased voters. And we've also gone into with some memorandum of understandings with surrounding states such as Kansas to compare our voter rolls with their voter rolls to make sure we don't have somebody, a Jayhawk, coming across the state line and voting in Missouri's elections. That same approach, centralized tools, local support, has guided our work in securities. We've streamlined how Missourians submit and track securities complaints while also launching a new investor education public service campaign funded through the Investor Education Fund. Investor education is a statutory duty of this division, and proactive outreach helps prevent fraud before it happens, saving both consumers and the state significant resources. Everywhere I go, I talk about our securities division, and I hear some pretty sad stories. Someone comes up to me afterwards and says, "Hey, can I get that number for the securities division because my grandma or my friend or my neighbor was scammed?" We have an instance of one lady in St. Louis that took out a home equity loan, maxed out her credit card, sent a $130,000 check to New York, only to be ghosted and never heard from the company again. So our securities division fights every day in order to try and get restitution for many of those folks. Let's see. Access across the agency, outreach has been organized and intentional. We are not waiting for Missourians to find us. We are meeting them where they are. That includes targeted outreach to businesses, investors, libraries, local election authorities, and educators, ensuring that they know what services exist and how to access them efficiently. Two of the programs that we have that are not well known, and we're trying really to focus on those as well. One's at the Safe at Home program, where the Secretary of State's office serves as basically the post office for anybody that does not want their address made public. And so we've got a lot of domestic violence survivors, and so obviously they don't want their attacker knowing where their address is, and so we get mail in the Secretary of State's office every day. They use our address as that, and then we mail them off their mail. Another program is the Wolfner Library. I encourage you, any of you that would like to read a book, we have audiobooks for those that can't hear, can't hear, but can't see and maybe have some trouble hearing. And so we have audiobooks that we record, and we don't have to comply with many of the copyright laws as long as they're used appropriately. I want to also highlight the Missouri State Archives. Despite budget constraints, the archives have continued to perform at an exceptionally high level. Its professional staff has responded quickly during environmental emergencies, such when we had a roof leak about a month ago. And so They were on top of it. The roof leak occurred over the weekend, so we didn't discover it till Monday, but timing is very important. They were able to get all those documents dried out and frozen. When you freeze those, many times that kills any mold that would grow, and they did an excellent job with that. This is an extraordinary public service in archives and continued support is essential to maintaining that capability and worthy of support. Finally, I want to emphasize that this office serves all 116 jurisdictions across the state, all 114 counties, the city of St. Louis, and the city of Kansas City, working every day with local election authorities, public libraries, and community partners. Our budget reflects that statewide responsibility and our commitment to delivering reliable, transparent, and efficient services. Yesterday, we had 368 Missourians file for office, both Republican, Democrat, as well as Libertarian, I know that all the candidates were very excited. As Secretary of State, I just wanted the day to be uneventful, and by all means, it was very uneventful. And hopefully, I know some of you filed for office yesterday, and it was hopefully you experienced that same thing. I appreciate the committee's time and consideration. I look forward to answering any questions you may have.
Thank you, Mr. Secretary. Any questions? Senator Nurburn.
Good morning, Secretary.
Good morning.
Thanks for being with us this morning.
Yes.
And I don't think any of us filed for office yesterday. Unfortunately, our good friend, Senator Fitzwater.
I think I was the very last person through the building.
Oh, I'm sorry. Yes, of course you did. I'm sorry. Mr.
Yeah,
Chair.
remember
I
you've
was
discussed
thinking,
moving back to the farm so I could be your
I'm
senator.
not running against you yet. Not running against you yet. Time will come. But I do. You always do it. The office always does a great job on that day. And I know as you have hundreds of people come
Yes.
together, it's amazing how efficient that process really is. So thanks for your work, and I'm sorry for insulting you, Mr. Chair. I forgot that you did file, and I think it's a good opportunity to recognize that we have our colleague here, Senator Fitzwater. Grateful for every day he's able to still join us on the committee. But I want to dive into a few things,
Sure.
Mr. Secretary, in terms of since you've taken over at the helm of the Secretary of State's office, there have been a number of ballot summaries that have been challenged in court.
Yes.
And how many ballot summaries have been tossed out by the court that you have authored?
Well, I would say tossed out. I would
Challenged.
Challenged.
How many have been challenged so
And
far?
so what I would say, I've used this analogy. If we said on a scale of 1 to 10 with the ceiling, is with 1 being bright white and 10 being a dull white, and I said, hey, it was a 3, you said it was a 4, Senator Fitzwater said it was a 5. Am I right and you're wrong, or are you right and am I wrong? No. It doesn't mean we're both right or both wrong. It just means we have a difference of opinion. And so I know
how many have been rewritten?
by the courts, or
Yeah, by the courts.
So Amendment 3, obviously the legislature passed Amendment 3. That was the legislature's language. It was challenged in court. Back when Senate Bill 22 was in effect, the courts asked me to rewrite Senate or Amendment 3. I used the word, for example, I used the word amend the Constitution, Article 3, Section, I believe it was Judge Stumpy. No, it wasn't Judge Stumpy. Judge Green, that came back and said, hey, I don't like the word amend. I would like for you to use the word abrogate. Now, no one on High Street, if we polled 100 people, would know what the word abrogate means. So we went and looked it up. It means basically to repeal or amend. And so we changed the word to repeal, and then that was sent through. Then that was actually challenged in the circuit court. So the circuit courts agreed with my language. That went, it was challenged and went to the appellate court, and then the appellate court rewrote all of Amendment 3 and redid the bullet points and things like that. The other one.
And again, you're talking about the new Amendment 3.
Yes, talking about the new
Amendment
Amendment
3, that will be sometime in 20.
That's right. That's
Okay.
right. Yes. And then there's another one, I believe, on the initial petition that has been rewritten. That was the legislature. I believe the legislature put that one on. It was challenged. I had some new wording on that. Then I believe that we are still waiting on the circuit court judge to come up with a final determination of that. So it's
Okay. Is there another? So you'd mentioned the IP process.
the referendum
Amendment
language.
3. What about? There's several dealing with education as well, vouchers as well as.
Oh yes.
School funding.
I believe that's the toter lawsuit.
Okay.
Yes, and so yes, that one's being challenged as well.
And then what about the suit challenging the language surrounding congressional redistricting?
Yes, that's the referendum language that I was talking about.
Oh, okay.
Yes, and so yes, I will say that no matter if you're a Republican Secretary of State or a Democrat Secretary of State, whatever language that you put in there, somebody does not like the language and may not think that that is fair and accurate, and that's by all accounts, that's part of the legal process, and then so they challenge that language.
Okay. It seems though, and I'm new at this. This
Yes.
is year 6 for me in the General Assembly, okay? But it seems like we are having more and more of these challenged. And again, looking at, as we are the watchdog here for tax dollars, I'm concerned as to how much we are spending in court on these cases. The Attorney General's office represents you, correct?
Yes, we have our own general counsel and deputy general counsel, but yes, the Attorney General's office does represent us, yes.
So what I'm trying to figure out is more or less how much we have spent, the taxpayers have spent on legal fees, on attorneys, on these ballot challenges. And I don't know if your office can help us with that, or if that's a question for the Attorney General's office.
Well, they are Attorney General employees. I think that would be a more appropriate question for them. I will say that we could have up to 10 issues on the ballot this year, and so there's going to be more challenges. They're currently, I think, there's been 140 initiative petitions that have been approved for circulation in the state of Missouri. That does not mean we will have 140 on the ballot, but we could if they turn in the signatures by the deadline, I believe, in May. One of those is about a casino at Lake Ozark. Obviously, there's some that are going through the legislature right now. I think there's one over in the House that talks about work requirements for Medicaid. I'm sure whatever language that you all in the legislature come up with, and that if that goes on the ballot, that will be challenged. The income tax, elimination of the income tax, I'm sure that if that goes on the ballot, whatever language that you come up will be challenged. And so there's quite a few more. I will say that even though some of these cases are very high profile cases, we went back and looked at prior Secretary of States and how many times that they were sued. And so far, I believe I've been sued my first year 10 times. The prior Secretary of State, Secretary Ashcroft, over 8 years, was sued about 300 times. The Secretary of State before that, Secretary Kander, in 4 years, was sued about 125 times. And the prior Secretary to that, Secretary Carnahan, over 8 years, was sued about 300 times. So on average, we are getting sued less, I guess, than the prior 3 Secretary of States. Now, I take my job as Secretary of State very seriously. I take the ballot language that was tasked to me in Senate Bill 22 very seriously, although as everyone knows that ballot language has been, or that language has been thrown out, and so I do not have that authority anymore in order to take 3 bites at the apple and write that ballot language. I believe that system that we had with Senate Bill 22 was a good system. As far as I'm elected by the people, both Republicans, Democrats, Libertarians, Constitutional Party, progressives, liberals, conservatives, and the appellate judges who ultimately write many of this are not elected. They are appointed, and then they are retained. And so last year with Senate Bill 22, that was not our bill. In fact, I don't believe we testified in favor of that last year. I believe we testified for informational purposes only. But seeing Senate Bill 22 and the effects and the powers that it did give to the chief election officer in the state, we did testify in favor of that this year.
Okay. Going back, actually, I appreciate you giving us the historical context in
Yes.
terms of previous suits with other Secretary of States. But one of the things on the referendum for
Good morning, everybody. This is Families, Seniors, and Health. We're going to begin as a subcommittee, so we will begin with Senator McCreary and Senate Bill 899. So, Senator, whenever you're ready.
I think the words were, hey, we think that if we can take that back, we can do better. I don't think the word flawed ever came out of the attorney's mouth or my mouth. Yes.
That you could do better.
Yes.
And you essentially.
We would take another stab at the
And,
language.
but you essentially sided with the plaintiffs on this and said, yeah, you're right, this isn't, I thought there was the word flawed in there somewhere. I might be
Yeah,
wrong,
I
but-
think that's what came out in the media was flawed, but I think the words were something to the effect of, hey, we believe that we could defend the language that is in there, but we will be glad to take another stab at making a more fair and accurate ballot language.
Okay. And then again, just going back big picture, when we're looking at this, I mean, times are tough financially for the state moving
Yes.
forward. And I just think about how many resources are spent every day in court when we could be using those same dollars to fund all of these vital services. And that's been a really frustrating thing, right? And so,
Right.
Again, just trying to figure this out, that moving forward, what is the best process? Is it some back and forth that we have to decide as legislators in terms of a new Senate Bill 22 and giving other time to get that language right? I don't know, but it's been pretty maddening to see so much of this tied up in court over and over again when, again, hopefully we can get a better stab at it the first time.
Yeah,
Okay.
and I appreciate your comments, Senator. We do have the fewest FTEs that we've ever had as far as actual employees in the Secretary of State's office right now, and I do take my job very seriously as Secretary of State, and although some of these court cases, like I said, are high-profile court cases, on average we've been sued less than the prior 3 Secretary of States.
Okay, thank you.
Thank you.
Any further questions? Secretary, let's begin our vote.
All right. And so what I'd like to do with the chairman and members is go through the overall financial summary, and then I'll be glad to answer any questions at any time, but then also go through the NDIs and kind of explain those. So if you turn to
That'll be
page
good.
3 is the overall financial summary. And so our budget varies quite a bit between election years and non-election years. And so if you look at our department request versus the government recommended, election summary is one of the biggest differences, about $6 million. We believe that there could be up to 10 items on the ballot this year. Again, the legislature is considering several of those. There are 140, like I said, I believe 140 plus petitions out for circulation right now that anytime that you put any of those on, including I had a meeting with the Missouri Press Association where we talked about, hey, if the signatures are verified and certified, that the referendum alone could be 140 pages that would have to be printed. And we were talking to them about how exactly that would happen. So we had visited with the governor about that 46 million that he had recommended versus our 52 million, which includes, I believe, $8 million, which is another NDI that we'll discuss here in a little bit, but that would not be adequate if all 10 items are on the ballot. So that's one of the things that we're concerned about. The other is the Information Technology Services Summary. So we have 10 million. The governor recommended 5.7. The difference is that we asked for an NDI that we'll talk about a little bit. We have our own IT department in the Secretary of State's office that is funded by the $5 business services fee. That business services fee applies when you either start a business or you dissolve an LLC or not-for-profit. You pay $5. It's been $5 forever. We had bills last year in order to extend that sunset. Unfortunately, they didn't make it through. We have bills this year to extend that sunset, but that's about $4.2 million of GR. If we are not successful, or the legislature does not pass that extension of the $5 business services fee, we would need a new decision item of a little over $4 million to fund our IT department. Our IT department, I mean, hackers try to hack into our systems every day to get the business services information and to get our voter rolls and registration and things like that. So we put an NDI. The governor is a lot more hopeful or is very hopeful, and that the legislature passes that bill, and so that's why he did not include a new decision item for that $4.2 million. And then the
Senator
last.
May.
Yes.
Good morning, Senator.
Good morning.
Who has that bill and where is it?
There's two bills that are currently making through. Senator Carter had an elections bill, and part of that elections bill was that IT services fee. I believe that was heard in committee this past week. I've met with, talked with, I know my legislative director, Amanda Bell, as well as I have talked to your minority floor leader about some concerns that they had with that bill, and we're looking at making some changes with Senator Carter, maybe to reduce that down to just the part. I know Senator Nernberg, I think I read some of your comments about that as well, and you'd had some concerns about other portions of that bill that we did not, that's not our bill. The portion of our bill was that IT fee. So that's was heard in committee this week. The House version of the bill, Representative Banderman, it passed out of rules this week and is waiting for the Speaker Patterson to put that bill on the House calendar.
Okay, thank you.
Thank you. And then the other big item would be the library services summary. And so, and we'll get into more detail too, but the library is one of the 5 cultural partners. And so according to statute, as part of one of the 5 cultural partners, we should be getting, I think, 10%. It's subject to appropriation. Some years in the past, the Secretary of State did not ask for that. I said, well, statutorily, we should always ask for it, knowing that we will probably not get it. But I think that it's my responsibility as Secretary of State to always ask for that. Any questions? Be glad to answer any questions on the financial summary. All right. If you turn to page 11, this is the NDI, again, that I just explained for the IT services, $4.6 million. The governor is counting on the House and the Senate to pass that bill, and so he did not include that as an NDI.
Mr. Secretary,
Yes.
quickly while we discuss that, 2 questions around that.
Yes.
With the 100% flux that you have within your department, if this bill doesn't pass, can you handle it if it stays where it's at? Do you feel like that you can handle this until a supplemental next year within your flexibility, or have you even thought about that? Those 2 things, those 2 factors.
It would be very tough. It would put a strain on us. Now, the funding, the sunset does go through December 31st of 2026, so we would have funding for the first 6 months, but then after that, we would not have any funding. And, with the supplemental bill, I'm not for sure what the supplemental bill is for this year in the process. The goal at this point today is for us to be, it's in the Senate now. Okay.
It's read in. At this point, our hope is, or we're planning on hearing it tomorrow.
Okay.
That's the plan.
Okay.
And then hopefully getting it done by March. And, when you and I served together, at the beginning, those things were happening. But
That's
then
right.
we moved later. Sometimes supplemental, I was afraid it was going to pass after the regular budget bills got passed. But
I believe it put a strain on our budget, especially for those first 3 months until the supplemental was passed, if it was included in next year's supplemental.
okay, thank you for answering my question.
Yes. All right. The next. Next one is, let's see, page 16. It's a new decision item. It's very well known that last year the legislative budget cut 22 FTEs as well as withheld about $800,000. The governor has recommended putting that back in. He did it a little bit different way than we did in our budget book as far as our request, but we agree with the new decision item from the governor in order to restore 13 of those 22 FTEs Again, we have the lowest number of actual employees that we've ever had. I've always said that as a statewide elected official, we should always grant them a little bit of grace in order to form their administration. I believe this would give us the authority for about up to 250. However, different administrations have different focuses. And so sometimes they want to focus on archives. Sometimes they want to try and maybe beef up their securities division and things like that. So we agree with the governor's new decision item on this. He just went about it a little bit different way.
Senator Nuremberg.
Thank you. Just to clarify, how many FTE do you currently have?
I believe actual employees, we have about 190.
190. And how many vacancies do you have?
Would be about 50.
50 vacancies
Yes.
currently?
Yes, about 50 vacancies.
But
But we
You
are
have the NDI for,
13 and a half there. We cut.
and is there another spot with an additional 13 and a half?
No.
Or- Okay, this is the NDI for 13 and a half.
Yes.
But tell me, so why are you not able to fill the current vacancies?
Well, it's not that we're not able to fill all of them. Some of them it's carryover from prior administrations, and so we're looking at consolidating some of those FTEs. Some of it is I think with business services is probably our hardest division to fill, where we always have a lot. I tell those folks in business services they're on the phone all day long, dealing with people that have issues as far as starting a business and corporation, and maybe they did something wrong or they're not quite sure how to do it. And so it's a very high pressure job where you're on the phone constantly. And so we usually have quite a bit of turnover in the business services. But we're almost in what I would consider fully staffed.
Okay.
We do have, I did not get out on the website this morning, we do have a handful of open positions. We were, out of those 22 employees that were FTEs that were eliminated out of the local records as well as the library, we did have some other positions that came available over the past year, and we were able to hire about 5 of those folks back in different departments within the Secretary of State's office. So I think I would just ask for some grace. I always say, hey, I'm the 41st Secretary of State. There's going to be at least 40 after me, and there was 40 before me. So I would say I would always ask to give all statewide, as well as Secretary of State, a little bit of grace as far as molding their administration and what exactly that they want to focus their employees on.
Okay.
Senator.
Can you share with us, can your office follow back with the committee to share the vacancies by department or by division?
Yes, yep,
Okay,
be
thank
glad
you.
to. All right, let's see. The next one would be page 38. We talked a little bit about this. This is a new decision item required by Missouri Constitution, Section 116.260, to publish the full text of the statewide ballot measures in newspapers. Because of the unpredictability of the number of ballot issues, this decision item is necessary to have funds available to cover the cost of printing. We've been working with the governor's office. Governor's office recommended $8 million. We recommended $14 million. We've been working with the governor's office and providing them more information about how much it would cost if we do have up to 10 items on the ballot, including, like I mentioned before, the referendum alone could be up to 140 pages. 140 pages would take a supplement, I think, to the local newspaper in order to get all 140 pages put in there. And so we're working with the governor's office because we do not believe that $8 million would be enough to cover our statutory obligation and make sure that we were able to publish in all the newspapers that state statute and the Constitution says that we should.
Mr. Secretary, see whether you want to answer this on the microphone
Okay.
or say I'll get back with you. But as you discussed the second time you've brought this up
Yes.
during our talk, You have any expectation of seeing some kind of governor's amendment on this?
Yes, I do. I do. All right, the next one, new decision item, page 45. Required by section 115.285 RSMO to reimburse election authorities for the cost of using business reply permits on absentee envelopes returned by users. We're asking for additional $130,000 as the fiscal year 25 actual was $191,000. And so we pay, or we reimburse the county clerks for absentee ballots that they put in.
Senator Nuremberg.
I know we're going through NDIs, so I wanted to stop you, if that's okay, on the
Sure.
next page, on page 47, if that's
Okay.
okay. So talking about federal election reform, when we're on this tab, can you share with us what information your office, or let me rephrase that, what information has the federal government requested from your office?
Yes, the federal government has requested voter rolls, and so we've been complying with Missouri state law. In Missouri state law, it says what we can and cannot give as far as voter rolls.
And can you just share with us very briefly, what is that? What can you share?
We can share name, I think address. We cannot share any of their personal information as far as like social security number, driver's license number, and things like that. So there's some things that we can share, and when they requested that information, we have given them, the same thing that if you came down and requested the voter rolls for the state of Missouri that we could give to you or any citizen here in the state. But we have not provided any personal identifying information that state law says that we cannot, barring a court order. If we would get a court order, then obviously I would be forced to submit that information, but we have not received a court order.
Okay, thank you.
You're welcome. All right, page 58. So page 58 is the elections cost transfer. Senate Bill 592, passed in 2018, allowed for election cost of statewide elections, General Assembly, and issues to be proportionally paid by the state if appropriated. The new decision item, transfer ask of $10.5 million, went from a transfer ask to an increase in appropriation use of 3562 state fund. Currently, it's at $12 million.
Mr. Secretary?
Yes.
Adam just handed me, I know there were some governor amendments come, not the one I previously talked
Okay.
to you about, okay?
All right.
But I do have a governor's amendment that was brought to us
Okay.
in this line for $7 million additional GR. Did you know that, I'm not trying to catch you. Did you know that amendment had been dropped yet? And could you speak to the need for that amendment, or?
Yes, I believe
I'm sure you knew that you were asking for it.
We knew
but
that we were
I didn't know
asking,
whether
and
you knew the answer.
we knew that we were asking for it, and my understanding it had come, and then maybe yesterday was somebody jumped the gun and they took it back, and so now it sounds like it's back on there.
They didn't pick up the copy I have.
Okay, all right. So you're still, I got you. Yes, yes. We have been, like I mentioned before, we've been working with the governor's office on that, and I'm glad that they didn't pick up your copy yet.
Okay, so that $7 million does not help with the 140 pages to be printed, though, correct?
As far as on the election cost transfer, no, it does not.
This additional $7 million will be, how do you see it being helpful? $7 million general revenue one time for election administrative improvements to be paid for with federal repayments. And
Let me-
make sure that I've stopped you in the right place. Bill section 12.09, yes, that's it.
So the 10.5 went to 11.285.
Yeah. Mr. Chairman, can we get a copy of that amendment? I'll be glad to.
Okay. Yeah.
give you the
It-
answer after after my
the
team's
new
had a chance to
total,
look at it.
At the
Okay.
bottom of the page, the new total, instead of being 10.5, the new total is now going to be 11.2. A
Okay.
little bit over 11.2.
Okay, so
That's- that's good.
700,000 more.
I'm sure somebody will make sure that this looks right on both ends.
Okay.
Thank you.
We'll get the answer back to you. Thank you, Senator. All right, then the next new decision item would be page 97. This is something that we talked about before. The NDI is only to increase the appropriation of the library networking fund if the transfer rent increased by 1.2 million. As we've stated before, the library is one of the 5 cultural partners, and so it always is subject to appropriation. And therefore, as Secretary of State, I think that the Secretary of State should always ask for the money, and then obviously it's up to the legislature if they want to appropriate that. The governor did not recommend the increase to the full 10%. And then page 105 is the same thing, the NDI to increase that library transfer to 1.2 million. The governor recommended 0.
Senator May.
So I know, did we finish? I don't want to interrupt before we finish.
Nope.
Okay. So my question is, on the last question, do you consider, the requesting of voter rolls by the feds, is that federal overreach?
No, because I do not believe the information that we provided is publicly available to any citizen, anybody that asks for that information. So no, I don't believe that is federal overreach.
You think it's unusual?
No, from my understanding, in the past, under both Republican and Democrat administrations, the federal government has asked for different information as far as voter rolls. We have been in compliance with, we were one of the first states to utilize the SAVE database with the federal government to identify any non-citizens. We are currently working through that list. Some states, when they submitted their voter rolls for the SAVE database and got question marks back on some people, they immediately deleted those people off the rolls. We have not done that here in the state of Missouri. We are taking it very seriously and going through an investigative process, working with our Republican as well as Democrat local election authorities to verify citizenship. In some cases, we have seen where some of these folks have become naturalized citizens, or they weren't, and now they are, and so they are eligible to vote here in the state of Missouri. And we've seen some instances where non-citizens were registered to vote. Now, I'm not prepared to release the facts and the figures and the numbers on those yet, but that's an ongoing investigation with our office.
Okay. And one other question. Earlier you mentioned that, so this is just for my clarification.
Yes.
Normally I hate to ask a question that I don't know the answer to.
All right.
But in this one, are foreigners allowed to do business in the state of Missouri?
Foreigners are allowed to do business in the state of Missouri. And I guess you're referring to the trailer park issue?
Yes.
Yes. And so businesses are supposed to update their information as far as their contact information with the state of Missouri, as far as their contact information, who the principal is, and things like that. When it was brought to our attention about an alleged Chinese-affiliated trailer park sitting next to Whiteman Air Force Base, we utilized the tools in our office to try and contact the principal. I believe we gave them 75 days statutorily. They're supposed to respond within 60. They did not respond within 75 days, and so therefore we revoked that business license.
Okay. No problem. Thank you for the clarification.
Yes.
Senator Nunberg.
So honestly, just to follow up on that, as Senator May was talking, it brought me back to your opening remarks, Mr. Secretary, where you shared that you've entered into an MOU with Kansas
Correct.
to share voter rolls.
Yes.
Have you entered into an MOU with any other surrounding states or other states?
Yes, we have, I believe, Tennessee, Texas, and Florida.
So why those states?
Well, Tennessee is a neighboring state. Florida and Texas, we have a lot of snowbirds, people that like to go down there where it's a little bit warmer
Are
than
you
than
looking
Missouri.
enter into MOUs with all states? Or
Yes, we would love to enter MOUs with some of the other states, but we've really been focused on the surrounding states in the state of Missouri because, as you know, living in the Kansas City metro, you get a lot of people that move back and forth from Kansas and Missouri. And so Secretary Schwab in Kansas has some of the same concerns. They don't want anybody moving from Kansas to Missouri and then still going back in Kansas and voting in their elections, much like we don't want anybody living in Kansas voting in Missouri elections.
Okay, so I want to go to another question I have.
Okay.
Certainly recognize that, and I fully support removing the sunset for the Technology Trust Fund on that
Yes.
piece of legislation. You shared that last year your office did not testify in support of Senate Bill 22. Just this week, we had Senator Carter's bill in front of us that had, and you mentioned this, really grave privacy concerns were raised about all of this very personally identifiable
Yes.
information being published on your website, but your office testified in support of that legislation and not just for informational purpose to say, hey, this is just our one section, we just need to remove the sunset. And so I guess I think it's important to have some clarity, and I appreciate your comments today that we're not going to that you respect privacy of our citizens,
Yes.
that you're not going to have that overreach and all of that. So again, that was a big one, Mr. Secretary, to have your office say, we support putting all of this information displayed on the Secretary of State's website, names, addresses, dates of birth, in a time when there's so much identity theft and fraud going on right now, to have your office say, we're okay with all of that being displayed for 4.5 million registered voters in the state. So I guess my ask would be, as we have a lot of bills moving through, that we, as every department, every statewide elected, really think that through, and how you're supporting, or again, just testifying for informational purposes.
Okay. Thank you, Senator.
Any further questions? Thank you, Mr. Secretary, very much. Have a great
Yep.
day.
Yep. Thank you, Mr. Chairman. Thank you, members of the committee.
Director Wilson, patiently waiting, haven't you been? Smiling the entire time. We're happy you're here. Please begin.
Okay. Thank you. Good morning, Mr. Chairman and members of the committee. I'm Sarah Wilson, Director of the Missouri Department of Health and Senior Services. Thank you for the opportunity for my colleagues and I to present the fiscal year 27 executive budget as it relates to our department. Governor Kehoe's proposal reflects fiscal discipline while prioritizing essential services that protect Missourians. Our department remains committed to our mission to protect and improve the health statewide. The Department of Health started the work of integrating priority-based budgeting principles before the ask of the Senate. Every program and new decision item is evaluated on alignment with state and department priorities, expected outcomes, and readiness, not historical spending to the extent that we have that flexibility. Through our performance management framework and the Achieve It system, we track over 1,000 metrics across 128 units, focusing on activity, efficiency, quality, and impact. This approach allows us to report outcomes clearly and make data-driven decisions that maximize value for Missourians. Health has value. The overall health of our state is shaped by individual behaviors, community environments, and the systems that support them. Health outcomes depend upon access to care, economic stability, education, safe environments, and choices. The department's work spans prevention, safety, and early intervention to crisis response, always working with an emphasis on measurable impact. Today, you will hear from each of our 6 divisions who deliver measurable impact. The Division of Community and Public Health, who prevents outbreaks and offers public health programs to reduce chronic disease. Last year, over 100,000 communicable diseases were traced in our state, and over 100 outbreaks were successfully contained. The State Public Health Lab, whose ability to detect newborn threats may prevent the child from developing severe brain damage, seizures, and intellectual disability. They pick up specimens from a variety of places and for a variety of testing reasons 6 days a week from over 160 locations. The Division of Cannabis Regulation ensures licensure of cannabis facilities. The tracking requirements ensure the products from licensed facilities are trackable and traceable. This reduces the chance of large-scale public health crisis. Senior and Disability Services, who implements programs to reduce the reliance on institutionalization of our seniors and investigates allegations of abuse of our parents, grandparents, and loved ones, elevating the information to those who can take active steps to protect them. Our Division of Regulation and Licensure, who performed over 2,000 inspections in healthcare facilities last year and aided healthcare employers across the state to ensure over 619,000 people they hired did not have criminal backgrounds. And our Division of Administration, who processed over 57,000 claims and oversaw over 2,200 contracts across the state. Our $2.2 billion budget is 69% federally funded, and 80% of the general revenue that the department does receive supports home and community-based services. Missouri invests only $7 per person in public health, the price of a specialty coffee or drink, and the lowest in the nation. Future investments will be needed and should focus on building a more coordinated public health system, which in turn strengthens other key priorities for the state, such as education, safety, and economic growth. However, when times are lean, the department must also contribute to a reduction in spending. Make no mistake, these decisions are difficult and may negatively impact our staff, our partners, including local jurisdictions, and other Missourians. The most immediate priorities of the department for long-term success must focus on sustaining and expanding our workforce capacity, modernizing public health data systems, and balancing fiscal discipline with core functions amid federal shifts aiming to increase the state's share. Strong leadership, collaboration, and innovation are essential to improve outcomes and control long-term costs. Together, we can build a healthier, more resilient Missouri. Thank you. I look forward to your questions, and if there are none, I'll turn it over to Maddie Starnes, our budget director within the Department of Health and Senior Services.
Anybody else have any questions at the beginning? Director, I do, both from our meeting as well as other people speaking to me, and the work that you're doing on changing, maybe not changing the collection of data. I don't know whether that would be a correct statement, but on the use of that data, as you know, I'm 100% for us starting to look at that. Have you been doing this long enough that you've seen any improvement in decision-making, you think, internally yet, that you would say, or do you think it's too early to say that this system that you're putting in is helpful at this point? And will you be able to judge it honestly? You know, it's something that I want people to do, and I'm going to have to be able to honestly judge it 2 or 3 years down the road. Is it the right thing, or do we need to shut it off and go some other direction?
So I think any time that, or in my experience in healthcare, whenever you start to look at what are the outcomes from what you're doing or what intervention that you've put into place, it impacts what your next step is, because you're looking at outcomes and you're making a decision based upon what ultimately it is that you want to achieve. We started this process of really ramping up how we look at the metrics that are measured by the department around the early part of the summer last year. We have built those metrics and met with each one of the divisions. Our operational excellence leader has done that and met with each one of our divisions to make sure that our outcomes were truly good outcomes, measurable outcomes. That has been built into our Achieve It system, and we actually go live with those dashboards in April. But what I will tell you is just the conversations around the why do we do what we do has spurred different kinds of conversations within the department. And while I can't provide you with what that measurable impact is today, I can tell you that the division directors are committed to looking at what it is that we do from a perspective of what is the impact that we are making, which gives us our why. So I think that as we move forward, obviously our intention is to use that information to be able to look at the programs and services that are offered by the department and ask those questions. Are we making the most impact that we can? Should we course correct, or should we try to head in a different direction? And where can we partner not only across our divisions, but across departments at the state to see that impact in the end? So that's what I would
Well,
say.
Certainly, I want to, and I believe the committee wants to be a partner with you on this step that you're performing.
We
And I
appreciate
hope
that.
2 or 3 years from now, and I think it will take that long to really evaluate, yes, this was the right thing. And I do believe that your commitment and the people around you that are committed to this are people that understand that today this is the metrics, but you're the type of people that will, no, that's the wrong thing. We need to go after this, and be willing to say, yes, we made a mistake going here. We got to go here. That's how the system ultimately will help Missourians.
I agree with you, and I thank you for that call out, because it's not been the easiest work for everyone. And certainly any of the members of this committee who would like to talk more about what we're doing or see some of that, we'd be glad to share that with you.
Well, I don't remember whether you were here that day or not, but I can remember when our school system and principal stood in front of me and said, all those objectives you used for the last 20 years are worthless. We're going to start doing SMART goals that were truly measurable, truly this. As an old man, I didn't want to, and I was in my 40s at that time, but as an old man, I didn't want to hear that. But in 3 or 4 years, you certainly could see that I knew what I was doing better as a teacher, because I knew that I was pointing to that. You know, it didn't. So thank you so much. Please begin when you're ready with your books, unless there are other questions from the committee.
Good morning. As Director Wilson mentioned, my name is Maddie Starnes, and I'm the Budget Director for the Department of Health and Senior Services. As requested, our presentation this morning will focus on cores with major core changes and new decision items.
Okay, did everybody hear that? So if you have other questions in places, you're going to find those. Okay, thank you. Please begin.
Okay, we'll begin on page 8 with a statewide new decision item for the FMAP adjustment. And this funding is requested to compensate for the change in the federal medical assistance percentage, or FMAP rate. You'll see a similar new decision item in the Department of Mental Health and the Department of Social Services. We'll now move into our core operating budget. And I'm joined up here by Division of Administration Director Chad Ritter. The Director's Office core on page 11. The Director's Office serves as the focal point for leadership and coordination across the department, and it partners with various stakeholders across the state. You'll see the core changes for this core on page 14, and they relate to a core reallocation and a reduction for general E&E. And you'll see that general E&E core reduction throughout the budget. Overall, it totals about $60,000. We'll move into the Division of Administration on page 17. And the Division of Administration provides administrative and financial support services for the entire department. The Office of Human Resources is also included in this core appropriation, and the changes are found on page 20 and 21. On page 20, you'll see a reduction for excess authority, and that relates to the opioid settlement fund. It was determined that administrative dollars aren't an allowable use of those funds, so we've reduced that authority here. And then on page 21, there's governor recommended reductions. The first two relate to vacancies, and the rest are further reductions to E&E. Then our first new decision item is on page 29 for the Health Initiatives Fund transfer. This new decision item seeks to increase the Health Initiatives Fund transfer to match our current spending authority in the Health Access Incentives Fund. The current transfer amount was set in fiscal year 2013, and it hasn't been adjusted as the HAFE spending appropriations have increased over time. That will conclude the Division of Administration's budget, and we will now move into the Division of Community and Public Health. We'll begin with the Cancer and Chronic Disease Control Core on page 63, and I'm joined by Division Director Lori Brennicky. The Cancer and Chronic Disease Control and Prevention Core reflects programmatic areas that work on the prevention of cancer and chronic diseases such as heart disease, diabetes, asthma, and arthritis. The core changes can be found on page 67 and 68. You'll see on page 67 and throughout this division's budget that there are some reallocations that were many reallocations that relate to the division's programmatic realignment of spending that occurred 2 years ago. State fiscal year 25 was the first year of operations in this new structure, and so these core reallocations are throughout the budget to continue to refine the core needs and reduce our need for flexibility. Page 68, there are some governor recommended core reductions. And then we have a new decision item on page 81 for the Children's Health Insurance Program cost to continue. And this funding is requested to support the purchase of immunizations for children enrolled in the Children's Health Insurance Program. This additional funding is needed due to growth of eligible children in the program.
Okay, I do want to ask a question about that. Can you supply me now or soon what utilization rate or percentage of CHIP enrolled children receiving vaccinations were assumed in this calculation?
We can get that information for you.
Okay.
Yeah. The next core will be page 84, and that's the Community Health and Wellness core. This core reflects our work in reducing health risks and, in turn, increasing the health of our citizens and communities. The core changes are found on page 88 and 89. On 88, there's some reductions in federal excess authority and also in an other fund. That was the Governor's Council on Physical Fitness, and it was a one-time donation that's been expended. And then on page 89 are some reductions to this core's E&E. Page 94 is the Substance Use Disorder Grant Administration core. And this core, the division operates the Substance Use Disorder Grant Program, which is funded with proceeds from the Veterans Health and Community Reinvestment Fund, or proceeds from the Adult Use Cannabis Program. This core reflects the PS, E&E, and FTE needed to administer the Substance Use Disorder Grant Program. And the core change for this one relates to a reallocation of FTE that's found on page 97. It was a reallocation of vacant FTE. And then on page 99 is the Substance Use Disorder Grant Program. This program awards grants to agencies and not-for-profits to increase access to evidence-based, low-barrier drug addiction treatment programs, support overdose prevention education, and to support job placement, housing, and counseling for those with substance use disorders. The funding for these grants is from the Veterans Health and Community Reinvestment Fund.
Mr. Chair,
Yes, Senator Washington.
the governor's recommendation, can you kind of explain why that's almost 12 million less?
Yes.
The governor's recommended budget proposes to change how the substance use disorder funding is appropriated. So currently there are this core for, and then various other cores throughout the book for initiatives to mainly the Department of Mental Health, but there is some initiatives to elementary and secondary education, as well as the Office of State Courts. And what the governor's recommended budget proposes is to reduce those cores, reduce some of the appropriation here, and the new decision item on page 104 seeks to have a transfer of funds to the Department of Mental Health to support their initiatives and a transfer to the Department of Corrections to support their substance use initiatives.
Thank you.
Okay, please remind me again, Health Reinvestment Fund, which column of funds does that truly come from?
So the health reinvestment funds that we're talking about here, they come from the adult use cannabis sales. So those, after our operating cost, the proceeds from those funds are distributed in equal thirds. So 1/3 is the public defender, 1/3 is the Veterans Commission, and then 1/3 is here to the Division of Community and Public Health for substance use disorder grants.
This is not to you, but the people that wrote that in our Constitution. Wouldn't it have been better if we didn't call these new funds and just said cannabis money? Yeah. Then everybody would know them. We talk about transparency. They did a good job of hiding that transparency. Thank you.
So we'll move to page 104, which we briefly talked about, but this is a new decision item that requests to establish transfer authority to the Department of Mental Health and the Department of Corrections to support their various substance use disorder initiatives that align with the Constitution. And the amount of the transfers can be found on page 105. The transfer to Department of Mental Health is a little over 22 million, and it's 1.8 to the Department of Corrections.
Okay. Yes, Senator Nuremberg.
Okay, so I see this, I guess, kind of going back to page 99. I'm curious how the department's going to move forward in getting word out about these grants. When I look at the unexpended dollars there for 24, 25, there was a lot left. And so I'm just curious, obviously, there's so much work to be done in this space. How are we going to get word out about these grants to make sure that those dollars are used appropriately?
Good morning. I'm Lori Brennicke, the Division Director for Community and Public Health. Thank you for that question. Yes, we realize it took us a while to stand this up.
Okay.
First, we needed staffing, as you can see the transfer in of vacant staff to do that. We had to write RFPs, meet with all of our partners, figure out what is the best use to make these RFPs available. And then in our process this past year, the governor's office did put a pause on us to take a look at this funds and how maybe they could be best utilized for some of the needs in our state. So we did have a little delay in the actual issuance in this past year. But I would say one of the ways that we've done this is that from the very beginning, or to increase the public awareness of these grants, we collected names, emails from folks who are interested in, and then we have across the department many partners that we work in all kinds of public health capacities. So does Department of Mental Health, some of our other partners in this work, like the Institute of Mental Health, other agencies, and broadcasted these opportunities through all those partner groups. So in the RFPs that we actually gotten out, we had a lot of response to those, actually more responding with great applications than what we had funding for. So I appreciate it. We are, trying to build the network and making sure that those who are interested who can do this work in the communities do know about it.
Okay. Thank you.
Please continue.
So, as I mentioned, in the governor's recommended, or his proposals, the next 8 cores relating to SUD grants have been reduced. So I will move to page 147 for tobacco addiction prevention. And this core reflects funding for youth tobacco use prevention initiatives to implement evidence-based interventions to prevent and reduce youth tobacco use. And this core was fully reduced in the governor's budget. So page 152 is for tobacco cessation. This core reflects funding for tobacco cessation, which makes funding available for services through Missouri Tobacco Quit Services. And the reductions for this core can be found on page 155. Page 157 is the Division of Community and Public Health Administration core. And this core reflects the leadership positions of the division, along with the staff that support common operating functions in the areas of fiscal management, public information, general counsel, and information technology coordination. Those core changes are found on page 160 and 161. There's some further reductions for excess authority, and those relate to the donated fund. Then in the middle of the page on 160 is the reallocation of FTE. There's the out that we saw previously. And then on page 161 is a reduction for Division of Administration staffing. This relates to an effort that we completed over the summer. Each division had fiscal staff, and we brought those fiscal staff together in the Division of Administration. And so there's some savings here and throughout the budget. Total, it's about $250,000. Page 165 is the next core with changes. This is the Emergency Preparedness and Response core, and it reflects programs that manage public health and healthcare planning in response to emergencies. The core change within this core is found on page 169, and it's a reduction of budget stabilization funds that have been expended. Page 173 is our Environmental Public Health Services core. And this core reflects our work to reduce the risk of illness, injury, and death related to environmental causes and ensure sanitation and safety practices that protect overall wellness. For this core, the core changes are found on page 178 and 179. We have a reduction of excess authority related to the lead abatement fund. It's a small fund with some excess authority. And then there is a reallocation that seeks to reallocate funds from this core to the State Public Health Lab to align our spending or our appropriations with how we intend to spend the dollars. This specific reallocation is related to the Legionella program. And then on page 179 at the bottom, there's the governor's recommended reductions to general E&E and Legionella response. The next item is on page 201, and that is a new decision item for our data system maintenance. This request is for general revenue to support the ongoing annual maintenance of the Reportable Disease Information Registry System. Federal and state statute outline that the department is responsible for coordinating investigation and response activities for over 90 reportable conditions for the over 100,000 cases and approximately 100 outbreaks in Missouri each year. The system is essential for automatic and continuous ingestion of electronic reporting of specific communicable diseases by healthcare providers and laboratories across the state. This collaboration ensures timely outreach and effective management of communicable diseases in Missouri.
Okay, I'm going to ask you to stop right there. Please, anybody listening in or even sitting in here, I'm not necessarily saying that this is something that I don't agree with, all right? But when we come to IT, and I've just seen my previous life, IT is always going to save us money, but does nothing but go up and up and up in cost, is what it ends up doing. And this is another example of that needs to be done, must be done. But my guess would be you can't say, well, this will be it, Senator, and it's actually going to go down by $5 million next year because we do this. But my overall question that around IT and all departments, not just this one, today the system we're using seems to just keep elevating. I've been involved in the movers conversation. You're getting tired of me just providing a sermon and not coming to a question. My question is going to be, have any of the departments thought of any models on IT that we might possibly look at that might actually be more efficient, or we get what we want a little quicker with those kind of things? Or do you think, my first time asking this on the microphone, nobody's thought about that since IT was developed whenever the caveman took a bone and a hammer in and started writing "It's hot in August" on the wall? Anybody thought about any of those things or not, do you think?
I will tell you that's all I think about, or at least 95% of what I think about. The Department of Health and Senior Services carries some of the most valuable health information in the state. It is information that must be timely. It must be able to be usable, and we have a lot of opportunity. But you're right, data modernization isn't cheap, and it's not going to necessarily get cheaper in terms of cost of systems. One of the areas where it can be cheaper, and one of the things that we have been looking at is because we haven't invested in systems that can serve more than one purpose, and with the onset of systems that don't reside on individual servers and their own standalone platforms, we are looking, how can we, one, decrease the number of homegrown systems for which the expertise is not there to continue them, to the systems that don't have interoperability, where we can have information that is shared among systems, and those that are just so outdated that it requires specialty contracts and specialty entities to be able to help us pull this information out and be able to make sense of that information. So yes, we are thinking about that. How can our people have access to the information they need in order to do their job more efficiently? And also where we can leverage collaborations across departments to have systems that are interoperable and will talk with one another, not sitting on an individual platform, but where we can pick that information in a manner that we need to at the time that we need to do it. Yes, it's not an easy answer. It is going to take years of really looking at our systems and revising them so that we can be able to move forward in a manner that's more streamlined, and that we can use the information in an efficient way. We are behind.
Rural transformation help dollars.
Yes.
People have been coming into my office, I think lucky enough to have somebody working on that doesn't share anything with me that they shouldn't, but shares with me overall. One of those things is timeline. To be able to meet the requirements, I guess, of the stuff that's in HR 1. And maybe the federal government will provide grace on those timelines, but maybe they won't, because other states will want our money if we don't get it done.
Yes, they will.
I mean, right now I have people coming to me wanting me to write the $216 million how it comes out, and I don't think they would think I would do a better job, but they might get what they want. We can't mess that up, and if a data system's a holdup, I think that finger will be pointed. I think there's 3 departments primarily going to touch that money. Am I right or not? Being the overall deciders on how that money is going to be spent. How many departments will ultimately, probably every department, but ultimately 2-3 departments in charge of helping put that money out the door in the future? Or is it only one?
The Rural Health Transformation Program is being administered by the Department of Social Services. The Department of Mental Health and the Department of Health and Senior Services have certainly been asked to engage and to be involved and to provide input on that program. And yeah, So we have been brought in, looped in. We don't administer it, but we are helping to guide, which the department should. The Department of Health, we're impacting health policy across the state, and so I do appreciate the ability to
I
leverage our
certainly do
expertise.
as well. And the canary in the mine that once in a while speaks to me says that there's timelines out there, and if we mess these up,
Yep.
and my guess is everybody will point fingers at everybody except for the person responsible on those.
Generally, when things don't go well, there's always someone that you want to blame. But as a state, this is ours to succeed. It is ours to not succeed. And we really, in my opinion, should look at it as a collaborative way to bring additional dollars and help into the state of Missouri.
Thank you. I did learn technology is never going to get cheaper. I'm going to be dead, and it's not going to be cheaper.
You and I both, yeah.
Okay. Senator Bank.
Director, thank you. Good morning.
Good morning.
So, I don't know if it probably did it before you came or after, but I'm not sure. With the elimination of the minority health department within your division, how are we addressing those things like chronic illness, premature infant mortality rate? How are we addressing those and focusing on those issues? Because in the African American community, you had a division that was basically directly focusing on those metrics and those outcomes. And since we have extremely higher rates, even with cancer, even with, diabetes, high blood pressure, things like that, how are we addressing those in the department now?
The Office of Minority Health is statutorily required and has not been eliminated within the Department of Health and Senior Services. In fact, just last night, I was looking at our an Aging Missourian report and conversing with our Division Director for Senior and Disability Service, saying, has our Office of Minority Health reviewed and contributed to this as well? So, no, that has not been eliminated.
Okay, thank you.
Senator Nuremberg.
I actually had a question about that too, so I'm just going to jump in now. So appreciate Senator May's question there. So have we made any strides in terms of decreasing maternal mortality and infant mortality?
I think that Director Brennicky would be best able to answer that, but to my knowledge, it depends upon which maybe individual factor that we're looking at, but overall, we've not made the strides in the state that would reflect a turnaround of our maternal and infant mortality rates in the state of Missouri.
So where do we rank today in terms of
Lori, do you know
maternal
our actual
mortality?
ranking?
And sorry if I jumped the gun a little bit on this. I know there's some.
It's okay. I know on the infant mortality, I'll have to get back with you on where we rank. I might have it in my book on the maternal mortality. I know that in infant mortality, we did take a bump 2 years ago, and then that went back down. So sometimes the rates, just looking at it on 1 year at a time isn't a really good way to look at it. But I will tell you that for both rates, we're nowhere near where we would like to be. We're not a state of stellar of something to be proud of when it comes to those rates. So there has been a lot of work in those areas. I would say on the maternal mortality side, what we have seen is a difference in the causes, and a lot of the preventable deaths due to like cardiovascular disease type issues have decreased, but we have seen mental health issues and substance use disorders being rise to now being the most significant concern for our pregnancy-related deaths.
Okay. Well, thank you for the answer. Obviously, we were hoping to see some improvements, and I know there's always the next thing, what's happening. I appreciate even, for example, with in Mo Health Net, for example, we have our pregnant and postpartum women are receiving blood pressure monitors, for example, which is incredibly helpful in terms of being able to diagnose preeclampsia and cardiovascular disease and all of those things. But this is one of those areas where I know we've put some money toward it,
Yes.
but it is tough to continue to see that we rank below some developing countries, quite frankly. And I just it's appalling to see that in a state where we have so many resources that we have moms and babies dying every day from stuff that's preventable. So,
On the maternal mortality side, there's some great facts. In fact, we can send those over if you like to see the difference of different protocols and different evidence-based things that have been implemented, and some things that we have seen in outcomes that have been improvements. But there's always an ever-changing environment around us too, in terms of things that factor in. We have now more closing of rural delivery units and those kinds of things. So we have to constantly pivot when we make a win in one area to refocus. And one of the things in the budget book is, for the maternal mortality side, is they have recommended that we break down the domains and have one pot of money. It has been reduced, but that would allow us to pivot a little bit more easily to focus on the things that really come up to be the main focus of priority, instead of having 4, 5 different appropriations of different types of activities.
and if you can follow up and share some of that information, I'd love to see it.
Sure.
Thank you.
When you share that, share it with staff so everybody can get it. I've
Sure.
had a couple other people talk about wanting to have it as well. Thank you.
Anything else you want to add?
Yeah.
Does this work? My name is Dr. Heidi Miller. I serve as the Chief Medical Officer for the Department of Health and Senior Services. The maternal mortality has been a top priority. And the PAMA report, which is the Pregnancy-Associated Mortality Review, meticulously tracks every single maternal death. And the last review was 2018 to 2022. And with that estimate, it was about 70 women that were dying during pregnancy or a year after pregnancy. That was actually a slight decrease. It takes a tremendous amount of work to collect that data. And so that does not include a lot of the developments that we've done since then. So we're going to need a couple more years to prove that what we're doing right now is reducing maternal mortality, including the maternal mortality prevention plan. It includes multiple components. We're engaging with hospitals, health centers, and one of my favorite components of that is the Maternal Health Access Project, where any doctor, any provider, any midwife can pick up the phone and get help to help a pregnant woman or a postpartum woman with behavioral health or substance use disorder problems. So there is an enormous orchestration of our efforts to address maternal mortality, but we need more time for the epidemiologic data to prove the effect of what we're doing, but we're tracking it.
I believe the next core will be the HIV, STI, and hepatitis core on page 203. And this core reflects our programs that focus on prevention, testing, linkage to care for treatment, and prevention of reinfection and the spread to others in relation to HIV, sexually transmitted infections, and hepatitis. The core changes for this are found on page 207. There are some reallocations to align the budget with anticipated spending, and then there's a reduction of federal authority towards the bottom of the page. Page 211 is local public health agency support, that core, and this core reflects the funding provided to local public health agencies in order for them to provide core essential public health services. This also represents the staffing for the Center for Local Public Health Services, which provides opportunities for training, support, and technical assistance to our over 115 local public health agencies. Missouri would not be able to provide the public health services statewide for many of our core functions if it were not for our vital partnerships with local public health agencies. The core changes can be found on page 215. At the top of the page, there's a reduction in federal excess authority, and towards the bottom, there's a reduction of $2.3 million for local public health agency support. The next core will
What,
be
on that on all of it, as we discussed public health, got any prediction of what individually this might cause out there? Because locally, public health authorities with this reduction they're going to make decisions on their side, right? They're going to make decisions locally. Does the department have any guess at what those decisions may be that they reduce?
I would say overall that what we could anticipate is they will definitely have to decide, which of the core services are most important, and they may need to reduce their effort towards some. Also, some may also reduce even hours of public service availability, so that would close access to like vaccinations or even to be open for folks to come in and get a vital record at the local level. So they are locally governed, and so this funding cut, will have implications for them to make some of those decisions. But, some of our concerns are, we know with the level of spending that we have in the state, as Director Wilson talked about, the $7, it's difficult for many of them to do, most of them cannot do all what we call core public health services. So this reduction just even reduces that.
Okay, so that's the bad news. Is there any good news in rural health transformation dollars for health centers?
Well, certainly we've been encouraging all of our counties, jurisdictions that are in that rural designation to be part of that transformation, because they are a key player in delivering health services. I don't think that there's an amount of dollars or things that are just allocated per entity that cooperates, but the hope is that as an entity, they come together in their hubs of services and say, who can do this? This is most important in our area. Who's going to be able to do this? Who could do that? What are our gaps? Could we use dollars from rural health transformation to fill that in? So hopefully we will see those things happen. And I know that some of our local public health agencies have been involved with a few hospitals that are part of the current torch model. And so they have seen examples where the things that they do at the public health level can be supported because it helps the overall goals for the healthcare system as a whole.
Okay, my more urban friends on this committee remember the 19 counties that I represent, so I recognize I was asking about rural and might not be your number one priority when it comes to these, so I do understand that. Thank you.
Page 220 is our core for nutrition services, and this core reflects the USDA nutrition programs administered by the department for the benefit of Missourians. These four main programs operated statewide are the Special Supplemental Nutrition Program for Women, Infants, and Children, or the WIC program, the Child and Adult Care Food Program, Summer Food Service Program, and the Commodity Supplemental Food Program for our seniors. The core changes are found on page 224. At the top of the page, there's a reduction of federal authority, and towards the bottom is a reduction of $250,000. The page 229 is the Rural Health and Primary Care Initiatives core, and this core reflects programs and services aimed at improving access to primary health care statewide and to increase health outcomes for those living in rural areas of the state. The core changes are found, there's one at the bottom of 233, but the majority is on page 234. These reductions are to the Health Professional Loan Repayment Program, our Graduate Medical Education Program, and the Rural Physician Grant. The next item is a new decision item for the Student Loan Repayment Program Federal Authority. And this new decision item requests additional federal authority for the department to accept the maximum additional student loan repayment program funds. Page 240 is oral health services and initiatives, and this core represents services and initiatives that improve oral health outcomes for Missourians. The core reduction or core changes are found on page 244. There's a $200,000 reduction to the Elks Mobile Dental Program. And then on page 249 is the core for the Office of Minority Health. And this core represents the work entrusted to the Office of Minority Health as established for purpose under Missouri state statute. Its goal is to develop public health interventions and strategies to decrease the rate of disparities in underserved and vulnerable populations that are geographically and economically isolated. The core change in this core can be found on page 253, and the core changes relate to a vacancy reduction and some general E&E. The next core will be women's health and wellness on page 257. And this core represents initiatives that serve to protect and improve the health of women and families by coordinating programs and activities across the state. The core changes are found at the bottom of 263 and on to page 264. There's reductions to the telehealth network and maternal smoking cessation, some doula services, and then at the very bottom of 263 is a core reduction to move the extended women's health program from House Bill 10 to House Bill 11, the Department of Social Services. On the back, on page 264, this is what Lori Brennicky previously talked about, where we're consolidating the maternal mortality programs, and then there's also a reduction. Page 267 is a new decision item for the Extended Women's Health Program, and this NDI was not supported by the governor as the program has been transferred to the Department of Social Services to align with their Medicaid programs. Page 270 is the Fetal Infant Mortality Review Core, and this core reflects funding to establish a statewide evidence-based fetal and infant mortality review program utilizing the national FEMUR model. The reduction to this core is a little over 831, and it can be found on page 273. And then the last core in this division was the COVID response and ARPA initiatives core. And this core reflects all federal grant opportunities the department received through the American Rescue Plan Act or coronavirus state and local fiscal recovery funds. They were received to address the public health impacts of the pandemic, restore public services, and build the long-term public health infrastructure necessary to meet future public health crises. This core changes you'll see on page 286 and 287, and overall we've reduced about $157 million of federal authority that's been expended. That will conclude the Division of Community and Public Health, and we will now move into the State Public Health Laboratory portion of the budget. I will be joined by Laboratory Director Adam Perkins. The Missouri State Public Health Laboratory has served Missouri for over a century, providing, well, the core is on page 292, sorry. The State Public Health Laboratory has served Missouri for over a century, providing critical public health protection through advanced testing for communicable diseases and chemical contaminants, specialized reference testing for pathogens, and emergency response capabilities during an outbreak or attack of chemical or biological nature. The core changes for this core are found on page 297 and 298. At the top of 297, you'll see those reallocations in that we've previously talked about for aligning our appropriations with spending. And then at the bottom of 297 and 298 are various reductions to the State Public Health Lab programs. Page 300 is a new decision item for the Safe Drinking Water Fund Authority. This new decision item requests an increase in appropriation authority in the Safe Drinking Water Fund for the laboratory's bacteriological testing of public drinking water. This additional authority will cover the cost to maintain the program at its current level of testing, which is approximately 60,000 water samples a year. The next new decision item is for the statewide courier, and it's on page 303. This new decision item requests general revenue funding to support the statewide courier contract due to rising costs and loss of federal funding. The courier system is a critical link in the state's public health network, and as it's responsible for bringing over 100,000 packages from across Missouri to the laboratory annually. These packages contain specimens that are collected at nearly every local public health agency and birthing hospital in the state, and they arrive the next morning. In addition, the courier system ensures a stable and appropriate transport conditions as specimens need to be kept at specific temperatures and free from damage for accurate results. Our courier system helps to ensure that we receive high-quality specimens transported in a timely and temperature-stable manner so that we can continue to produce accurate laboratory results that make the laboratory a trusted partner for all Missourians. That concludes the State Public Health Labs portion of the budget.
I want to ask about safe water drinking real quick. It's, I think, a question that there's no way you're going to answer, but is there some Big Chief tablet that has on it in 20 years, in 10 years, how many water supply systems there's going to be in the state of Missouri? I don't know if you know where I recognize, but we're pretty well regulating out of business most of our municipal water supply places, right? Or is there a number? if you don't have 10,000 customers, 15,000 customers, you just might as well go out of business now.
I would have to get you more information on that. It's going to be related to what those EPA regulations are, because our testing basically follows their standards, and we're basically providing that service from the
Yes.
bacteriological standpoint.
I know where I need to ask that at, but maybe they're listening and it'll show up.
Something
Thank you.
I was going to say something we check with the Department of Natural Resources as well.
Yeah, and Jim Macy, if you're listening from EPA, the question goes to you as well.
And one more thing before I step down, I just wanted to thank everyone here for the continued appropriation support for our multi-agency laboratory campus. That is under budget and on time to be opened here in October of 2026. That is a $184 million project with 5 agencies, combining our Missouri State Highway Patrol Crime Laboratory, DNR, Agriculture, Conservation, and Department of Health and Senior Services. And so really excited to show you all what that means when it comes to the laboratory science we do in the service of all Missourians. So happy to show you that whenever
No,
would
you
be
brought
willing
up
to.
something that hits another one of my
Oh, no.
sore spots. All of it was good, though. You said under budget.
Yep,
Is anybody going to be able to use it when they get in there?
certainly. Highway Patrol and DNR are going to be moving in there almost immediately.
And that question, or that somebody's listening somewhere, is who was involved in watching this project from beginning to end outside of, and I'm not criticizing FMDC, but I'm saying that sometimes we build things in state government, they get built, and they never ask the people using them what needed to be done. So from DHSS, was there one person on a construction management team that got to watch all the way through the process and make suggestions all the way process? Because I believe ultimately, if the answer, you're shaking your head yes, then we could have other state projects come in under budget, on time, and we not spend $5 million remodeling when we walk in because an electrical outlet's in the wrong place. And I've made that mistake building stuff myself.
A few things, if I may, on that. Yes, I've been engaged with this project since the summer of 2022 when we were first interviewing some of the architecture firms. So we have been involved, and there's been
Was it build
representation.
design in any way? It probably wasn't, was it?
What's that?
It was not a build design project, was it?
No, that was the other thing I was going to highlight. It's one of the first construction manager at risk programs we did, where very early on within the project, we brought on McCown and Gordon, the contractor, and where they provided a lot of value was that engineering cost to make sure that, what does steel cost, what does concrete cost, the prices of so many things have fluctuated. So they were on very early to make sure that while we wanted to get what we wanted to get, including every outlet where it needed to be, they were there to make sure that what we were doing made sense financially and that we could also deliver the materials on time as well. So I really think that's been a major part of why this project has been successful.
Sounds like you need to write an editorial and put it in everything so people know it can be done. Thank you.
Thank you, Mr. Chairman.
We will now move into the Division of Senior and Disability Services portion of the budget, and I'm joined up here by Division Director Melanie Highland, and we'll begin on page 314 with the non-Medicaid programs core. The Senior and Disability Services non-Medicaid programs core provides service coordination and rehabilitation services to adults living with a traumatic brain injury, service coordination and additional resources for eligible families who have children with medical complexities, and temporary short-term services for eligible adults and seniors who have been victims of abuse, neglect, or financial exploitation. The core changes can be found on page 318 and 319. There's additional reductions for excess authority and COVID and ARPA authority that's been expended. As well as on page 319, there's a reduction to the non-Medicaid eligible program, which sunset last June 30th, and then a reduction to the silver-haired legislature. Page 321 is the Medicaid home and community-based consumer-directed services core. A Medicaid recipient can choose between 2 models of care to receive Medicaid home and community-based services. Self-direction or consumer-directed services is the first model, where the participant is responsible for hiring, training, and directing their personal care attendant, or the agency model is the other model of care, where a participant selects a provider agency who then sends a trained direct service worker to aid with the activities of daily living. This core that we're looking at on page 321 is the first core for the consumer-directed services. And the changes are found on page 324 for a reduction to the HCBS workforce surveys, and then there's the FMAP adjustment related to that first NDI. Then page 327 is the other half of the program, and the core changes are very similar, but on page 330 and 331, there's a reallocation, the reduction for workforce surveys, and the FMAP adjustment. There's also a proposed reallocation to move the complex care assistant to this core to align with the other the similar services that are provided. There's also an additional reallocation that's not reflected in our book, but it relates to a governor's amendment that came out earlier this week. And the additional reallocation is from this core to the area agencies on aging core to help support those agencies with meals. So we'll talk about that at that core.
We'll talk.
Or no, that's fine.
Melanie, explain to it. It's here to my right. Put it in rusty black language. What does it mean? This governor's amendment, the reduction, moving to meals. You've had to talk to me on the phone more than once about this kind of stuff, so just explain it to me
Okay.
so I know,
You got it.
so I understand.
Yes, for the record, Melanie Highland, Director of the Division of Senior and Disability Services. So what we're talking about here with the AAA home delivered meal rate. AAAs are the provider of Medicaid home delivered meals in the state. And so there's a couple of things that are going on here. You'll see some reallocations from from this core, the HCBS core, to the AAAs, because that represents about the $14 million of funding that the AAAs are already getting, but because it's Medicaid and it's delivered as part of a home and community-based services benefit, is captured in that HCBS core. So this is one trying to be more transparent about how much of that is going to AAAs for home delivered meals reimbursed by Medicaid at the current rate. That current rate is $6.71. That actually does not cover the actual cost of the meals that the AAAs are delivering. And based on our rate study work that we've done, we know that their actual cost is around $10.99. And so what this does, these core allocations, is that after working extensively with each of the AAAs, they are identifying some GR that is not currently being matched in their core, and they are willing to basically put part of that up for a state match to be able to increase their reimbursable rate, the cap, from $6.71 to $10.99, and are able to draw down around $5.3 million federal funds to help basically to serve the cost that they're absorbing either through their local dollars or whatever non-Medicaid dollars that they receive. So the reallocations are to try to get the Medicaid piece that the AAAs are receiving for home delivered meals in the appropriate core, and then also it supports a rate increase that the governor's amendment talks about to basically help capture closer to the cost of what AAAs are actually experiencing for no additional GR cost.
Thank you for explaining that, because I'm sure by the time it gets to 80-year-old people that I know, that they may have trouble understanding and automatically think it's some form of cut. So thank you very much for explaining it. So hopefully if people start getting telephone calls, we've got the word from the person in charge.
I got a question. Okay.
Senator May.
So, first of all, thank you for that explanation. So it's not a cut, it's just a reallocation, basically.
That is the reallocation that was captured in the governor's amendment is moving the funds from one core to the AAAs, and then there's an NDI that will be in the AAA core for the additional federal earnings.
Okay. And so, yeah, it increased it to 10. I got it for the federal earnings. My question is regarding the contract for the meals. the delivery of meals, is that one contractor, or do we have various contractors? And how does someone become a contractor to deliver meals to the seniors? Because I get a lot of complaints on that issue.
Yes, so that is not one contractor. That is in our regulation, in state regulation. Basically, the AAAs are the Medicaid home delivered meal contractor.
Okay. Say that again, I'm sorry.
So we have 10 AAAs across the state, and per state regulation, they are the Medicaid home delivered meal contractor. Each AAA is governed by a local board that makes decisions following state and federal laws regarding procurement and all of that to procure a home delivered meal service. So whether that is they want to do that internally or they want to contract out with a separate entity, that is the decision of each AAA.
Okay, so can you give me a list of those AAAs? I want a list of those AAAs so I can find out, you know, who the board is and who's delivering meals in the St. Louis City area. That's
Yes,
my goal.
happy to do that.
Right.
Thank you.
The next item will be the Medicaid Home and Community-Based Services Cost to Continue NDI on page 344. And this NDI represents the increased cost to continue services for participants on the HCBS program and is associated with the fiscal year 26 supplemental. The increase not only restores the funding to prior year expenditure levels, but also represents increased utilization of services for what is projected through June of 2026. The next core will be on page 343 for the Senior Services Growth and Development Program transfer. Missouri State statute provides a dedicated funding for enhancing senior services provided by area agencies on aging. Of that funding, 50% must be applied to the development and expansion of senior center programs, facilities, and services. The core change for this for this core is on page 346, as there's a reduction to this transfer. On page 348 is the Area Agencies on Aging core. And this core supports the 10 regional area agencies on aging, or AAAs, and their network of 210 local senior centers that provide aging services to help prevent unnecessary or premature placement in a long-term care facility. The core changes for this core that are in our book can be found on 351 and 352. 351. And then the reallocation we just talked about for the governor's amendment, the reallocation and additional federal authority would be in this core. So you would see the reallocation in and then an increase in federal authority.
Thank you.
Page 355 is the Alzheimer's Services Core, and this core supports persons with Alzheimer's and other dementia-related diseases and their families or caregivers through caregiver respite grants, education, caregiver training programs, and assistive safety devices. There is a reallocation and core reduction on page 358. The reallocation or consolidation of these Alzheimer's approps and then a reduction of $1 million to the program. Page 360 is the Senior Independent Living Programs core. This core supports 4 local communities, allowing seniors in designated geographic areas to remain in the community rather than enter a long-term care facility by supporting healthy aging through increased community involvement and easy access to services. There's a core reduction on page 363 of $200,000. And that concludes the budget for the Division of Senior and Disability Services.
Thank you, Melanie.
Thank you.
We will now move into the Division of Regulation and Licensures portion of the budget, and I'm joined up here by Division Director Mindy Laughlin. Page 370 is the Division of Regulation and Licensure Operations. This core is responsible for the regulation and licensure of facilities across Missouri that provide a wide variety of healthcare services. The core changes can be found on page 374 and 375. There is a reallocation on page 374 to meet the state share requirements associated with our Title 18 federal funding. And then on page 375, there are some various reductions to the Division of Regulation and Licensure.
Senator Nuremberg.
We have some cuts to FTE here. Are these vacant FTEs that are proposed to be cut?
For the record, I'm Mindy Laughlin. I'm the Director for the Division of Regulation and Licensure. Those positions are filled at this current time.
So they're currently filled, and then in what area would you have to cut then?
This recommendation here, the reduction is in the engineering consultation unit.
And what are those folks tasked with?
Those individuals, that is a consultation unit within the section for long-term care regulation that reviews plans for hospitals or long-term care facilities that are building new facilities, are doing major renovations to a current facility. So they review those plans and provide feedback to ensure that they're in requirement with building construction standards and fire safety.
Okay, thank you.
Are those requirements secret in any way?
Are they secret in any way? No.
Okay, so somebody
but-
building those facilities should know the requirements around that unless what?
So yes, they have to, it's outlined in regulation what building standards there would need to be met. Statutorily, there is not a statutory requirement in regards to this function, but our rules do indicate like the building standards that would need to be followed in regards to
Okay. So
construction.
if I'm on a board building one of these, or CEO, whatever my title would be, doing this construction, it's still upon my responsibility or whoever I hire to make sure that they meet those requirements, correct?
Correct. We were just a consultation unit
Yes.
in what we were doing.
Yeah. Thank you.
There is, on page 375, there's a reduction for the Bureau of Narcotics and Dangerous Drugs, and on the page it says BNDD fund swap. And so there's the reduction of GR here, and then a new decision item on page 378 that seeks to move that funding to the opioid settlement funds. And so the Bureau of Narcotics and Dangerous Drugs Fund Swap, NDI, requests those opioid addiction treatment and recovery funds to support that Bureau's operations rather than the general revenue funding that was reduced on the previous page.
Okay, I have a couple questions around BNDD, so it doesn't matter which one of the places, I think. Status of the project now. Is there something we can just look at? If we're 65% done, we're 45%?
In regards to this system, with there was as we know, the process to secure can become complicated with contractors. So
No,
it has,
it does?
and it was a complicated process, and we worked collaboratively across agencies to get that put out for bid. So it was released for bid, I believe, on January 30th. Let me verify the date for sure. I have that in here. January 30th, it was put out for bid, and so we're in the process of getting the RFPs back, and the staff will be doing the review. I just yesterday, actually, I think Monday, asked
deadline?
about
When's the deadline for the
mid-February. I'll have to
RFPs?
get you the exact date
Okay, so it's probably
as to when it closes.
Everything's been closed.
Yeah,
Okay.
getting close. I think we did an extension because we had one of the vendors on Monday when I had an update meeting. One of the vendors had requested a little more time to pull a proposal together. So I believe it is still open, possibly through the end of the month, but I can get you an exact date.
That's fine.
once
You're
that's
giving me the
open.
information that I wanted.
Okay.
So I don't need to ask if there's a contract been awarded, right? Haven't
Not
I
yet.
already heard that answer? And timeline you think to get this accomplished once it becomes physically started? It's already started because we have to go through the process, so I'm not making fun of anybody on that.
Yep.
But once we start having people sitting and messing with code, then how long is that process going to be?
The
guess.
contract has, when it is awarded, there is a requirement to have that completed within a year of award. So the contract should be awarded prior to the end of this fiscal year that we're currently in. So therefore, it should be the project should be completed prior to the end of federal fiscal year 20 or state fiscal year 27.
Okay.
So
So we should plan on that.
correct.
Yep. You remember to tell me that next year. Same as done, Rusty.
Okay.
Thank you.
Page 381 is the new decision item for the Bureau of Narcotics and Dangerous Drugs system replacement that we were just talking about. That funding was one time in 26, so we're asking for the same funding ongoing in 27. Then on page 384,
And I found the date, January 29th. I was a day late in what I mentioned, so it was posted on January 29th.
on page 384 is a new decision item for the nursing home staffing campaign. This new decision item requests other funding to the Centers of Medicare and Medicaid Services Nursing Home Staffing Campaign. The campaign, which is designed to increase the number of nurses working in nursing homes, will target areas where the nurse-to-population ratio is 20% worse than the national average. That's approximately 41% of Missouri nursing homes throughout 78 counties in the state. Page 387 is a new
Stop a
decision.
minute, let me read that paragraph. Well, I've heard this hundreds of times in the last 9 years. How many contracts do we have going back and forth with CMS where we're paying money to CMS? Just a wild guess. There's a lot of them in there, and I've just forgotten it. Not only do they regulate us, but we also join partners with them and give us our money to tell us we can't do stuff. Okay.
I'll have to get
No,
back with you.
I think I just was thinking out loud.
On page 387 is the Bureau of Emergency Medical Services program audits, and this new decision item was not supported by the governor. Moving to page 395 is the Core for Long-Term Care Regulation, or our Quality Improvement Program for Missouri, or QIPMO. That is a cooperative service between the department and the University of Missouri Sinclair School of Nursing to provide education and training, share best practices, and improve care delivery at long-term care facilities to help them improve outcomes for their residents. The core change for this core can be found on page 398. There's a reduction for excess authority, and then there is the reallocation that we saw previously to meet our state share requirement.
Okay, question in this area is turnover rate within QIPMO. Do you have a turnover rate?
I don't have the actual turnover rate. I do know they've had some issues with having some vacancies, and that's the NDI that is coming up next. Maddie's going to speak to a little bit is in regards to trying to, from the PS side, for them at the University of Missouri.
And I
be
was
able to-
thinking that when we were in the office earlier, that's what this was referencing. And I can't remember what I was told what the turnover rate was before, because hoping in if we do this in a couple, 3 years, we know the turnover rate's not going to go to zero, but maybe, yeah, it really made some difference or not. Okay?
So I'll
That's
get
why
you-
I'm asking.
Yep.
It's freezing in here. They got the air on. I've been freezing all session. I need heat.
How many watts is that thing running right now?
I don't know, but whatever it's doing is wonderful.
I'm hot all the time. All right, the two senators will quit squabbling over heat. I've had something before, and I think I got to take my pants off because I get so hot with all the heat blowing out of that underneath her desk. That didn't need to go on the microphone, did it? Please begin.
That's okay.
On page 400, we have a new decision item for an increase to that QIPMO contract we recently talked about. This new decision item requests $75,000 of additional other authority to increase the contract with Sinclair School of Nursing, and this increase will support a wage scale increase. That will conclude the Division of Regulation and Licensures portion of the budget. And we will now move into the Division of Cannabis Regulation.
I won't be able to.
I'm joined up here by Division Director Amy Moore. We'll begin on page 410 for medical marijuana, and this core supports the administration of the medical marijuana program, such as oversight, compliance, and enforcement of medical marijuana facilities. We'll now move into, there is a core reduction for excess authority on page 413. The total reduction is almost $4 million. We'll now move into the transfers of the cannabis program. We'll start on page 423 for the adult use cannabis transfer. This core reflects the transfer authority of adult use cannabis proceeds from the department to 3 beneficiaries outlined in Article 14 of the Missouri Constitution. Those beneficiaries are the Public Defender, our Division of Community and Public Health for Substance Use Disorder Grants, and the Missouri Veterans Commission. Currently, in this core, these transfers are about $19.6 million each. There is a core reallocation on page 427. This reallocation is to a new transfer approach to skip an intermediary transfer for the Missouri Veterans Commission. So then on page 429, we have a new decision item, and this is for ongoing Veterans Health and Community Reinvestment Fund transfer authority. This new decision item increases the ongoing transfer authority for the 3 beneficiaries. It increases them to $20 million each. And then on page 432 is another new decision item, and this is a one-time new decision item that requests to ensure the department meets the constitutional obligation that each adult use beneficiary receive an equal third amount of any proceeds. During the fiscal year 25 session, the transfer authority for the public defender was reduced, and the department could not transfer the public defender their 25 supplemental amount. And then the last new decision item is on page 334, and this one-time Veterans Community Health and Reinvestment balance transfer, this new decision item requests an increase in the transfer authority for the 3 beneficiaries by an additional $20 million. This increase creates the ability to transfer additional funds to each beneficiary throughout the fiscal year if more funds are available than the ongoing transfer authority.
Okay, my question, let me do one first. And within these funds, the cannabis funds, recreation, what is the curve? I mean, right now it seems like we're in stage 1 of diminishing returns where it just keeps climbing overall. Where do you think, is there a guesstimate out there when it starts to flatten out?
Amy Moore, Director of the Division of Cannabis Regulation. It appears to us that we are reaching stability in terms of revenues. So it looks like the sales amounts, though it fluctuates each month, and occasionally you'll see news that this month there's a record number of sales, that overall we really have reached a stability. Now, there could be changes in the near future that could significantly affect that. Mainly, as you may be aware, there's been a change at the federal level, redefining hemp. If those changes go through in November of 2026, that really could disrupt the market as it is right now. I can't really predict how that would change things, but it could cause the revenues on the regulated side to increase, or in some scenarios even decrease. So that's something that we'll need to keep an eye on.
Okay, from your look at this, there are other revenue generated in other substances, wine, beer, et cetera. The increase we've seen here has touched those taxes as well, right? And caused some reduction there. Or people that are talking about that to me, are they not accurate? That we're not selling as much of this now, we're not selling as much of this now, et cetera. What do you think of that? And I know that's not your charge to pay attention to it. I just want to know whether you have any feelings about it, or just say, I don't have any.
I have heard the same things that you have, but I don't have the data or expertise to validate.
Senator May.
Okay. I got a note to myself right there. Okay. My question is this. Good morning.
Good morning.
Simple question.
Okay.
So we have, out here, we've been debating this, hemp and marijuana holistically for like 3 years now. And, I'm the outlier. So because, it's a balance for me of competition in the market. So let me ask you this question. Article 14's goal of basically preventing diversion to illicit markets warrants enforcement. Why haven't we utilized that, enforced the sale of what you call recreation or cannabis outside of licensed, facilities? Because we can under Article 14.
So I can speak to the department's authority. I agree with you. That purpose statement right there at the beginning of the law, both on the medical side and the adult use side, references ensuring that we don't contribute to the illicit market or allow the illicit market to participate in the regulated market. Our side of that is beyond that, under that purpose statement, a series of authorities that we're given. Like we can make rules to do such and such. All of the department's authority for enforcement references licensed facilities. So I can do things like issue penalties and fines and suspend and revoke licenses. But all of those things apply to the licensed dispensaries. There's nothing in Article 14 that tells me that I can, for instance, embargo product in an unlicensed facility. We really have to look at the body of the law to see what can the department do related to illicit market activities, and the vast majority of that law is talking about what can the department do in relation to the licensed facilities. So if they're not licensed, most of our authority for enforcement just doesn't apply.
Right. So basically, but the authority is there. The Constitution gives us the authority already. We don't have to invent the authority in Article 14 because it basically says the Constitution didn't legalize, unlicensed marijuana, and the federal law still applies. So with the federal law and the state law, we still have the authority to do it, but you're saying it doesn't rest with the department. Or I don't know why it wouldn't rest with the department and their investigators. Because our investigators have authority over licensed dispensaries. You are correct. There is other language in Article 14 about criminal penalties and what it does and doesn't legalize. And you are also correct that federal law still applies, and most of what we're doing is not compliant with federal law. I think it's something that we're all aware of. But just for the department's authority, our investigators are enforcing things like penalties, fines, suspension, revocations over our licensed dispensaries. Okay. So I guess that will be like the Attorney General, the police, and all of that can go after the what they call the unlicensed, because it just amazes me how we think we need to pass legislation to deal with what they're saying is happening, meaning they're saying cannabis is being sold outside of dispensaries. Well, you already have the authority to deal with cannabis being sold outside of dispensaries. Deal with it. Quit playing with me. You get what I'm saying? So that's my because I can read. I'm sure everybody else can read, but like my reading instructors told me, comprehension is another thing, so.
Thank you.
Thank you, Cinder, for this English language arts lesson. And with that, Department, thank you very much for being here. Before we adjourn, I want to remind people tomorrow we will be listening to a presentation on supplemental budget that is now on the Senate side of this building, and possibly anticipating voting on the supplemental tomorrow, as well as Public Defender's Office and the General Assembly. So with that, we are adjourned.
That's right.
Probably so.